in my teenage years, we moved to Rolla, Missouri, which is kind of central between St. Louis and Springfield, and went to college there. And I've always wanted to be a doctor. My dad's a physician; he's an orthopedic, and when growing up, he used to put casts on our arms. I just thought it was fun. I go into the office with him, so I kind of always wanted to be a physician.
Wow.
And then went to med school and did my training here in Kansas City, and loved Kansas City, and decided to stay here.
Oh, that's great.
Yeah.
Why'd you get into being an OB?
During my training in med school, we rotate through many different fields, and I just loved OB. It was a mix of being in the office and establishing a relationship with a patient, and you could also go to the OR and, you know, do fun cases and use your hands, and I just love that part of it. I love delivering babies. I love being in the room when the baby comes and there's the excitement and you see the emotions on the dad's faces, and that's just a great part of somebody's life, and it's great to be a part of that. So just love all of it.
Oh, that's great. What makes you excited to get up and come into the office every morning to see your patients?
Just the familiar faces. I love seeing all of our patients just seem so happy. It's a great time in their life. I love seeing the patients over, establishing a rapport. Group of physicians that we work with, we all, you know, have fun together. We all work hard, but we just really get along. I know that if I have a patient that comes in that I have any questions about, I can go to one of my colleagues and hopefully they'll have some answers for me, or if not, we'll, you know, figure it out. And so I think it's just, in our staff, they're all great to work for and make you feel good.
Oh, that's great. Dr. Ridgway, what makes you excited to get here and get in the office every morning?
Well, I think it's kind of the same thing. We one of the great things about being an OBGYN is that continuity and knowing women over the course of their lifetime with, you know, different events. I've been in practice long enough that I have patients that I saw as teenagers when they were first getting established with a gynecologist, and now I've delivered their babies, and when they come in for their yearly visits, I get to hear how those children are doing. So I kind of like that, getting to know my patients over the lifetime, and I think that's really special.
Yeah. How did you get into medicine? What drew you into medicine, and where did you grow up?
I moved a lot growing up, so I lived all over the country. I lived in Tennessee and Florida and Indiana and Michigan and Rhode Island.
Wow.
And I went to college in Ohio and medical school and residency in Texas, so we moved quite a bit. I've always liked science-related fields, but I wanted to do something that was directly related to people and helping people. So I think medicine was a good mix of those two things for myself.
Wonderful.
Yeah.
Good. Always like to hear backgrounds. That's always good. So let's talk a little about the practice. Let's talk about Women's Health Associates. You all are a well-established group. You've been in Kansas City for a long time. Tell me a little bit about when you all started and about how many babies you all see come through every year, about how many babies you deliver.
Well, I think I'm the old lady in the group. I started practice in 1992-93 in Kansas City with Women's Health Associates, and we've always been an all-female group, which I think is a really special thing. We deliver about 800 babies a year.
Wow.
So it's a pretty busy obstetric practice, although I think it's important to note that we do a lot of gynecologic care, and you know, are very comfortable with discussing menopausal issues and those kinds of things with our patients who are no longer in those childbearing years.
That's great.
I don't know if Dr. Ridgway will say this, but speaking of well-respected, Dr. Ridgway just finished up, right, her year as medical staff president at Shawnee Mission, which is a great honor because she was only the second woman to have that role. So she probably won't say it. She's probably happy her year's over. It was stressful and her juggling everything, but she did a great job. So that's just shows how she's respected and was asked to hold that position. So
you have a lot of girl power.
Yeah, we do.
That's right. We have 6 female physicians. That's pretty good that we all get along.
Female group. And I think it's a really special relationship because you know, our patients are women, and then also everyone has. I think women approach life and their personal and professional life similarly, and then that really helps. We understand each other. We're really there to cover for each other. I think sometimes the competition that can exist in groups that are mixed or that are all male isn't there on that level. It's much more of a cooperative kind of thing. I think that's why women tend to interact.
Yeah, and I think it's nice for our patients too, because when they come in with their stories about their sick kids or how they have to juggle their life, we, understand that, and I think that patients like that aspect of our practice.
Mm-hmm. Oh, I would agree.
Yeah.
That's great. It's like that girlfriend feel.
Yeah. That's right.
Mm-hmm. So tell me, as a newly pregnant woman coming to your office, what can I expect at my first appointment with one of your providers? What's the process? Walk me through that.
Well, when you call, you normally call around the time you miss your period, and within a couple of weeks we usually get you in to see one of our new OB, what we call our new OB coordinators, which would be either our physician's assistant or a nurse practitioner or a nurse manager. And the nice thing about that appointment is it gives you an opportunity to find out about our practice. If you're new and you don't know what physician you'd like to see, you can talk to them. We have a book and you can see our profiles. You can kind of see who would fit your personality, get a little bit of education at that meeting, pamphlets, information on what to expect during the pregnancy. And the nice part is they can take your full history and get labs so that when we see you as a physician, we already have that information and we can kind of target, the real issues that we want to focus on for that first meeting with you, and as well as do your exam then at that visit when you see us in a couple weeks.
That's great. What information would you want your patients to come armed with, being maybe a first time they're going to come see you as a new OB patient? Any information you'd like them to resource before they come see you?
Well, I think in addition to the general medical history, knowing what medications they're on, what the doses are, having specific information about allergies, it's also important that our pregnant patients do a little bit of research into their family history for whatever, maybe that there's a history of birth defects in the family, or maybe some children that have had special needs, and anything that they can do to know as much as possible about those illnesses or things that may run in their family will really help us give them an idea about whether that's a concern for their pregnancy.
That's great. Good. What should they expect from your staff when they first walk in the door to come see you?
Well, I think we have a terrific staff. From the front desk, you should get a hello and a really friendly welcome. From the nurses, you can expect some compassionate care. Our nurses are really experienced, and so, and most of them have worked here for quite a while, so they know how things work. They know what the doctor's preferences are. They know a lot about the hospital and can answer questions with that. And I think all the way around, it's supposed to be a really friendly, positive, uplifting time in your life, and we want to reflect that back.
That's great.
There are a lot of patients that have chronic problems in their pregnancy that come on, several times a week for different issues, and it seems like when they walk in the door, you can hear them greeted by name, and they seem to really know our staff. And at the end of their pregnancy, I hear a lot of people saying that they're sad to leave because they're
not going to be coming in every week.
Coming in, they will miss everybody.
Right.
And even if they don't have to come in several times a week,
Right.
even at the end, they just say, "I'm sad to not come here anymore."
Yeah,
That's right.
Yeah.
So.
Oh, that's great. So going off of nurses, we brought that up, talking about your experienced nurses. Tell us a little bit why there's a value in having the RNs and LPNs that you all have in your office, because all of your nursing staff is certified, correct?
Yeah, well, I think that the more education that our nursing staff has, the better equipped they are to help patients deal with questions and issues that they may have during their pregnancy. Again, my nurse and I have a long history together. We've worked together for the last 17, going on 18 years now. So that's a really special relationship, and she knows a lot of the patients personally by name, and so you get that real personal touch. When someone calls with a question and you know their history, that's really helpful.
Great. Tell us about your nurse.
Ruth and I have been here a little over 2 years now, and Ruth and I have worked together that entire time. She is a registered nurse, and she has quite a bit of medical knowledge when it comes to gynecologic and obstetric care. She's great with answering questions.
Super. You have several that have been in labor and delivery. in the hospital setting that now work for you, right?
Yes, we do.
We do.
That's
Which
great.
gives a whole different perspective. You know, office practice and labor and delivery practice are two really kind of different things, but it's really helpful to have nurses who have had experience on labor and delivery on staff to